Before that, if you love to read, and not just reading, but if you have been wondering how really cancer patients feel, what they go through on a daily basis, not just the patients themselves, but the people around them, their family, their loved ones, how they manage, the whole situation, most especially right after being diagnosed of having cancer, and then the entire journey, how everybody comes together to make sure that their loved one is okay. If you've been wondering, this book is for you. And I'm excited that the author of this book is here, Dying Many Times. And I have read a little bit of the book, and I'm highly impressed with how detailed this book is. And I just can't wait to finish it up. The author, again, like I said, is here, Benjamin Akyena Brantuo, and he's here to share with us the zeal, the force behind this particular book. It's about your wife.
Yes, Esedua.
Good morning to you.
Good morning.
How are you doing?
God has been very good to me and my family.
God indeed has been good.
Yeah.
The moment I opened the book, it's in chapters.
Yeah.
And I started reading the diagnosis bit. The very first sentence is how the doctor broke the news to you and your wife.
Yeah.
You were eager to know what was wrong with your wife.
Yeah.
And all she said was she has
cancer.
Yes. And mentioning ALL, you didn't know what it meant.
Yeah.
You asked what it meant. And I just want to know exactly what was going through your mind, how your wife took that news within that moment. But then before that, what were the symptoms that led to you going to hospital?
Okay, thank you so much. And I think back in 2019, I think the middle of June, at the time I was a staff here at Mod Media. I was a senior journalist with the digital news platform. So I had closed from work Friday. When I got to work, she had prepared meals and had set the place. Everything was ready, as every wife will do.
Yeah.
And then whilst I was having my meal, she was like, today I had an unusual flow. I knew she was menstruating, but she said today has been unusual. It didn't really strike me as odd because I don't think menstrual flows were even odd a day. So I thought that, okay, so that's okay. But she said, well, I've had to change pads. I've had to wear double my dresses. And still, anytime I sat on a chair, I can see that the chair has been stained with blood. So that was a bit concerning.
Yeah.
So I was like, we need to go to hospital. But the purpose I had come earlier was to go to church for an all-night service because it was a Friday. But then, given the situation, and I said that we needed to go to the hospital, she was like, it's fine, go to the church and come back.
And come back, yeah.
We need to go to the hospital. So we actually went to 37, and then we were admitted for a period of 2 weeks, and even that we didn't know what the problem was. So they kind of managed the situation, discharged us to come back for a review, and still we didn't know what was wrong. All we knew was that she was just bleeding profusely from the vagina, and that was basically about it. So that's how we came by the news. And for many other people, including so many people watching us this morning, that is basically the situation. You would have to feel unwell at one point or the other. Of course, in our case, it was leukemia, and leukemia is very typical of blood cancers. So we had symptoms relating to blood.
I think you had acute lymphoblastic leukemia. Acute
lymphoblastic leukemia in our case. Yeah. But for some other people, maybe cervical cancer, maybe breast cancer, neck cancer, throat cancer, the symptoms may not present the same thing. But you will certainly feel some form of illness.
Something, that is normal.
Something that is not well.
Yeah.
And then you decide to check it up.
Right.
That doesn't immediately stick you in that this is the condition. You have to keep moving from one thing to the other, to the other, to the other, until somebody says, can we look out for this? And then you begin to have a certain semblance of the situation. So that is what typically most of us go through. You have to roam until finally you begin to get idea. In our case, when we got a proper diagnosis of cancer, it was almost 3 months of moving up and down in hospital. So we started with 37 and ultimately ended up at the Cape Coast Teaching Hospital.
Right.
And that is where we finally got to it. And that is really the situation for most people who are dealing with it. And that is actually so because in this country, when it comes to cancer, you have just the teaching hospitals that have some amount of support systems to deal with it. I wouldn't say they have the comprehensive set of systems to manage it, but for the initial support and some amount of management, you will get it at the teaching hospitals. And nobody begins health situation management from the teaching hospital. You are likely going to begin from your community clinic or a CHIP compound or some small facility, and obviously they will manage you for what they know, or normally people will present, is it malaria, is it this, before finally you are forced to keep chasing, by which time the condition will really have been in a very advanced stage for which you are almost getting to die. Yes.
Again, I'm going to put it out there that this book is not just about a cancer patient's ordeal being, detailed in here, but also how dedicated her husband was.
Yeah.
Now, on page 43 of the diagnosis chapter, you highlighted a point where you had come back home from hospital, you had to take your son, get him prepped up for bed, and your wife was calling out for you.
Yes, please.
Because she could not stay away from you for too long. Yeah. She would get scared.
Yes.
What exactly was the fear?
Okay. Let me put it in context.
Okay.
So you have your wife who is critically ill.
Right.
And needs every minute of time that you can offer her. It isn't as if you just have supported her enough and so you can take a break, and out of just fear, she wants you around.
Yeah, okay.
The kind of attention she needed was so much so that you shouldn't leave her. This is somebody whose blood at the time had come to 4.5. Now, that is an emergency. That is an emergency. If your blood level comes to even 6, you shouldn't be sitting here. You should be admitted.
Yeah.
Okay. So because typically you should have between 11 to 15 for a healthy person.
Okay.
In our case, it was around 4.7. But given the critical nature of her condition and how much there was not so much blood available at the various hospitals, we had been discharged nonetheless to still come home and present ourselves the following day. So that was her situation. And then I have a 1.5-year-old son.
Yeah.
Okay. So between these two people, you just sharing just what is available.
What is available?
Good.
Exactly.
So
you have to attend to your wife. You have to attend to your little boy.
And again, let me emphasize that is the situation of people who are dealing with cancer out there.
Yeah.
At the last check, there were about 20.4 million cases as of 2024 globally, according to the global count of persons who had new cancer cases situation, 20.4 million. And then those that passed on as a result of the condition were about 9 million of that. If you come to Ghana, as far back as 2011, when we did the National Control Cancer Strategy, we had about 16,000 people having cancer every year. And then we had about 7 million dying globally as far back as 2016. So the situation I am describing is very typical of many families who are dealing with. The average Ghanaian, it's a nuclear family. So if you have a wife and children, let's say 4 of them, depending on their ages, and suddenly you are told that you have a cancer, you just have one person completely immobile and unable to do anything, and one other person who is able. The kids, depending on their age, are completely also dependent on the other family person who is able. Now, fancy the situation that you have to go to work. Fancy the situation that you have to prepare the kids for school. And fancy the situation that you have to take your wife to the hospital. How do you manage all of this? And let me emphasize that.
And not just even taking her to hospital, but then also being there, being present.
If you look at our health system, it's such that to run labs, it's the patient's relatives who do it.
Yes.
To go and get medications, it's the patient's relative who do it. To connect between even health professionals, it is the patient relative who does that. So imagine the situation where you as an individual, and in my case, I had a little boy. So imagine the situation that you are carrying this boy with you, and you are told that we need this blood, go and get people to come and donate, go and get this drug. And then you also are thinking about how to raise the money to get all of these things done. As I speak to you, my wife is passed on. To be clear, I am gainfully employed. I am doing very well. My son is now 8 years and he's fine. But based on what we experience, we said to ourselves that never again. No Ghanaian deserves to go through this. As much as our health professionals are extending themselves and doing so much to support all of us, we feel that is there something more we can all do to help the situation. So this is really not us versus health professionals, because at every point in time, we cannot become patient. How do we ensure that people who are currently dealing with cancer get the needed care? And how do we build the infrastructure that if me and you find ourselves, unfortunately, in that situation, we can be helped? That question is not being answered. And as we speak as a country, we do not have a centralized administration, something like the Ghana AIDS Commission that deals with AIDS issues, the Mental Health Authority that deals with mental cases. We don't have an administration like that for cancer. No. There's nothing like that. You have teaching hospitals that have specialized professionals who know their job as health professionals, and when you come, they do what they can do to help you. But as a national administration that addresses cancer holistically, you have the Ghana Health Service and the Ministry of Health with all that they do, adding that to their portfolio. So probably you may have a DEX officers or schedule officers who liaise with everybody else to deal with it. I do feel that the time is now for us as a country, given the rate of infection, the rate of prevalence, for us to set up this system so right. It will serve all of us so well. We need a national cancer authority that is in charge of the administration of cancer. Now, Ghana has done a lot of things, in my view, that is very good. When you take cervical cancer, you take breast cancer, the National Health Insurance tries to take care of it. There are about 4 childhood cancers that are also on the National Health Insurance. And then recently, with what this government did, we also have the Mahama Care that is taking care of non-communicable diseases, including cancers. You would see from what I'm saying is that the cancer budget is scattered at different places. Some at the National Health Insurance, some under the Mahama Care, and then in that form. Why don't we have the National Cancer Authority and then set up a National Cancer Fund and then make sure that we funnel all of these monies into that particular fund? And then based on the strategies that the National Cancer Authorities will put in place, the fund is administered accordingly. The fund is just one portfolio. The Cancer Authority is another. But what we need is national SOP, standard operating procedure. If somebody has cancer and they are in Kolebu, what is the SOP? If somebody has cancer and they are in Konfuanochi, what is the SOP? If somebody is at 37, there should be a standardized process for all health professionals to take a cue from, and for the National Cancer Authority to provide guidance and leadership on that. We also need what we call annual plan of action. So there's a National Cancer Strategy, there's a National Cancer Authority, there's a National Cancer Fund, and then there is a National Cancer Standard Operating Procedure, and then there's a plan of action. So for our strategy, what are we doing this year? How much of sensitization are we doing this year? How much of health professionals are we training this year? How much of health centers are we adding this year? Okay, based on trends, how do we escalate it in the next 5 years? If we do that, we will be able to cut the load in a certain progressive way.
That's true.
Rather than just feeling that we are overwhelmed with cancer.
Yeah.
We've put pocket of money here, pocket of money there.
The funds are scattered.
Yes, pockets of money there. But there is no coordination. Because if you take the Mahama Care, which is brilliant,
it is
incredibly good. The administration that is managing that, their focus is not necessarily on cancer management. Their focus is providing funds that support infrastructure, that support doctors, that support patient care. But funds in themselves don't treat anything. What the funds will treat is when you have a treatment plan which is tight and good, and then you can have the money run those infrastructures and deliver results. At the moment, we don't, and we are making a commitment to ourselves and inviting everybody on board that we've told our story here. Very painful. If you're able to read this book, you are brave. But much more than that, that is what people are living. Because I tell people that if you are struggling to read this book, you are reading it and you are struggling, but I lived it.
You lived it, exactly.
Others are living it. How do we ensure that never again? And the pain is that politicians are having cancer. Doctors are having cancer. You and I are having cancer. Yet nobody thinks that the time is ripe for us to take the bull by the horn, have a national cancer strategy and administration, and deal with this once and for all. And that's what advanced countries are doing. They have cancer authorities, they have cancer strategies, they have cancer SOPs, they have cancer plan of actions, they have cancer plans, and then they are rolling it out. Effectively, we can make results.
Benjamin, all you have suggested here is very brilliant.
Thank you.
It is brilliant, and we hope and pray that the right thing is done.
Thank you.
That's what we are hoping for. That's what we are, pushing for. That's what we are going to push for.
Thank you.
Even harder than just this. And so I entreat everybody to get this book, Die Many Times, The Struggles of a Cancer Patient. His faith was even tested at some point. I took a glance through the prayer camp chapter.
Yes.
On page 120 and page 121.
Yeah.
And your faith was tested.
Yeah, we were at the prayer camp, so we slept at the altar.
Yeah.
We danced around the church building.
Yes.
We drank from the well.
Yes.
We slept at the floor.
Yeah.
That's what cancer can do. And that's what cancer is doing to people out there. And it's about time we deal with it before it deals with us.
I like that. Where can we get this book?
Well, I have copies at EPP Books, and for now, anyone who wants to reach me via my contact at 0244-825187.
Please slow down with the number.
0244-825187. 0244-825187. We do deliveries. We are happy to deliver. And if there are bookshops out there that are willing to stock them, we are happy to provide. When I finished writing the book, I was highly traumatized. So there wasn't a lot of energy to do the marketing and administration. But from where we sit now, God has been good to us. We are in a good shape to be able to administer that, and we will be very happy. And then there's also this book, Starting All Over Again and Winning. Again, I wrote these two books for cancer people because once you have lost everything, because you can't be having cancer and work. You've lost your wife, you've lost your job, you've lost your family, you've lost your income. How do you start all over again? Be able to wear suits like I'm wearing and sit here as if nothing has happened. So this book will help anybody who feel like giving up. You don't have to give up. God is always able to support us in difficult times like this.
Thank you very much, Benjamin. Thank you so much for sharing this painful part of your life. And again, I entreat everyone to get this book. Get a copy of this. Die Many Times, The Struggles of a Cancer Patient. It's not necessarily you reading it to know what happens to cancer patients, but it cuts across. There's so much to unpack that have been unpacked in here, and there's so much to learn from, Benjamin Akyena Brantuo's dedication to his wife.
If I can just 1 minute. So the theme she's talking about concerning love. So in this book, you will see what to do as married couples when life happens to you.
Exactly.
What will you do as a family?
Yeah.
Children when life happens to you. And then there's the extended family. Because then some of them do fall apart when it gets too critical. So what to do when you find yourself? And then there are friends, social connections. How should friends relate to us? Okay, when suddenly we are not as beautiful, we are not as handsome, when we can't offer the things we used to offer. So you will see a team of love also in there for people who wants to be able to thrive in those subjects.
Benjamin, thank you once again.
Thank you so much.
Thank you for sharing this part of your story with us. And it's a wrap on this conversation. Again, make sure you get the book, get the phone number, call him that you want a copy of the book, Die Many Times, The Struggles of a Cancer Patient by Benjamin Akyena Brantuo. My name is Akyena Brantuo. Don't go away. Prime Minister continues.